This is Miriam Raftery with East County Magazine and the East County Magazine radio show, and I'm very pleased today to have with us our special guest, Dr. Mark Sawyer. Dr. Sawyer is the infectious disease specialist at Rady Children's Hospital. He's a vaccine expert on COVID-19. He's been consulted by the FDA for making recommendations on vaccines and boosters. He's done presentations to the supervisors, and I understand he also serves on a state advisory committee to Governor Gavin Newsom. So, Dr. Sawyer, welcome and thanks so much for joining us today.
My pleasure to be with you.
Well, ours as well. So today I covered a protest out on a freeway overpass in La Mesa, which was part of a statewide walkout by students, parents, teachers who are protesting the state's vaccine mandate, some of the masks as well, but primarily the vaccine mandate. Some of the parents believe that COVID-19 doesn't really pose a serious risk to healthy children or teens. So can we start by asking you, how common or rare are serious cases of COVID in children, as well as deaths? And can you explain some of the complications that you've been seeing at Children's?
Sure. The frequency of serious pediatric COVID is higher than people think. We have had a couple of hundred children hospitalized right here in San Diego at Rady Children.
It's quite a few.
Around 75 or so in the intensive care unit, and another 75 with the mysterious inflammatory syndrome called MISC that happens after COVID in children, which we're still trying to figure out, but has the potential to have long-term damage to various organ systems that are involved. So to say that COVID is not serious is underestimating the virus.
Okay, thank you so much for clarifying that. Have you seen any worsening of this with the Delta variant, which we know is more contagious? Is that hitting kids any harder than the original version?
Yes, just like with adults, we're seeing a surge in cases over the last couple of months here in San Diego and across the United States, which is attributed mainly to Delta, which is, as you pointed out, much more contagious. We're not sure it's a lot more serious than other strains, but just the sheer frequency of cases leads to some cases being severe.
Right. Let's talk about the vaccines themselves. Obviously, parents were concerned about the safety of the vaccines. Some of them voiced concerns specifically over things like, blood clots or heart conditions. In a handful of people that have had the vaccine. What should parents know about that? How safe are these vaccines?
Yeah, well, the first thing to say is it is true that there are some very rare but serious side effects from any of the COVID vaccines that we've studied so far. But it's very important to keep the numbers in perspective. In general, we're talking a couple of cases of severe side effect per million people getting vaccinated.
Yeah.
And if you do the math, you're somewhere between 20 or 30 or 40 times more likely to end up in the hospital if you're not vaccinated than if you are vaccinated. And that includes children.
Yeah, I saw a statistic from the CDC that they put out just recently within the last couple of weeks that said that unvaccinated people in general are 11 times more likely to die and 6 times more likely to contract COVID than unvaccinated. Is that holding true of children as well?
Yes, and we're seeing the same trends here in San Diego. So this is a clear indication to me that the vaccine works to prevent serious disease at least.
Mm-hmm.
And so the best way to get your family protected is to get vaccinated. It's pretty clear.
Yeah. And we should note that some of the very things people worry about with the vaccines, heart conditions, clots, which, as you said, is maybe, 1 in a million or very rare. But COVID-19, I understand, can cause the same things, right? How common are serious effects like that from COVID?
Yeah, I've actually seen estimates that the rate of heart involvement is just as much with COVID as it is with the vaccines. And that doesn't even count so-called long COVID, which we're still trying to understand, but persisting symptoms for months after COVID infection, that also happens in children. So
yeah. How common is long COVID in adults and children, meaning things that can last for months or years that can affect your brain, your heart, your lungs, other organs?
Yeah, I wish I knew the exact answer to that. I've seen estimates all over the place from 5% to as high as 30% of
Mhm.
people with COVID having some persisting symptoms. It's something that we're still trying to completely understand
Mhm.
from a medical perspective, but it's very real and happening to lots of people.
Now, some people objected to the vaccine, saying they don't think they've been around long enough, unlike, say other vaccines children get that have been around for decades. And they're concerned about what they consider an experimental nature on their kids. Don't make our kids lab rats, we were hearing. Can you comment on that concern, please?
Yeah, I have a couple of comments. First of all, there have been over 6 billion doses of COVID vaccines given around the world. 200 million in the United States. To put that in perspective, let's talk about a vaccine everybody knows about, the measles vaccine. We give around 6 or 7 million doses of measles vaccine a year in the United States, 6 or 7 million. And we've given 200 million COVID vaccines. So we actually know a lot more about COVID vaccines than we do any other vaccine.
Yeah, well, that's reassuring to hear. Thank you for sharing that. Um, are some of the vaccines safer or more effective than others, especially for children?
Well, I can't answer it completely for children because those studies are still ongoing.
Right. And we should note that as of today, I believe the FDA has only approved the vaccines for age 12 and up. Is that right?
And actually only for the Pfizer vaccine. So
right.
the Moderna vaccine is only at this point approved by FDA at 18 and above.
Okay.
That's about to change. The review of the Pfizer vaccine information by FDA for children 5 through 11 years of age is happening later this month.
Mm-hmm.
So I do anticipate we are likely to see a recommendation to start immunizing younger children. Back to your basic question about whether some of the vaccines are safer or more effective. In terms of safety, they all have side effects. The side effects are somewhat different between, let's say, the Johnson & Johnson vaccine and the Pfizer vaccine.
Mm-hmm.
But all of the safety concerns are relatively minor compared to the severity of COVID itself. It is true that the Johnson & Johnson vaccine as a single dose was not quite as effective as the mRNA vaccines as 2 doses. But as many people will know, the FDA just recommended or reviewed the data on a second dose of the Johnson & Johnson vaccine, and that brings it up to speed with the other vaccines.
Okay. So yeah, as of today, I understand, is this right? I heard this on the radio just coming over here, that they authorized a second dose of both the Johnson & Johnson and a second dose of Moderna now. Is that right? For those who didn't get Pfizer and have been waiting to get their booster shots?
Well, if they actually submitted the authorization, you're ahead of me. The advisory committee met last Thursday and Friday and did make the recommendation
Okay.
that FDA approved both of those for additional doses.
Okay. I may have heard that wrong. I tuned in the middle of a radio broadcast on NPR about it, so I may not have that quite right. But at any rate, if it hasn't been approved yet, it likely will be in the coming days, it sounds like.
Yes, I'm expecting it any day now. The CDC is actually meeting on Wednesday and Thursday to discuss the additional doses, and they normally wouldn't meet unless they were pretty sure FDA was going to issue their approval.
Okay, that's good to know. Could you address your opinion about whether pregnant women or nursing mothers should get the vaccine?
That question has been clearly answered, and it's incredible that all of the official physician groups who might have an interest in that, such as the Obstetric and Gynecology Group, the American Academy of Pediatrics, the World Health Organization, the CDC, everybody says yes, pregnant women should get immunized. We know that pregnant women are at much higher risk of COVID when they get it, and the babies are at risk too. And by immunizing mom, you can protect both mom and baby.
Yeah, we did have a pregnant mother die just within the last week here in San Diego, kind of driving home that point, die of COVID, I should say. So yeah, the data is out there. And where is the best source for people to go if they want to get information? about this? They always say we want to do our own research. Where would you recommend they go that would be reliable sources for that research, Dr. Sawyer?
Yeah, I think the best sources are the Centers for Disease Control or the professional associations like the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, and pregnant women, and the internal medicine group. Another answer to that is just talk to your doctor. Your doctor has been following these stories for the last year and a half and should have the latest information on risk and benefit.
There you go. Can you speak to mask wearing? Some people are asking, why are we still wearing masks when those that are concerned are vaccinated? Can you address that, please?
Well, unfortunately, since Delta has come around, we've learned that even vaccinated people can still get infected and transmit, even if they're not sick. So if we want to really get rid of the pandemic once and for all, we need to keep this transmission down, and masks definitely work to do that. And they're working in schools, they're working at the workplace. Physicians and nurses are all wearing masks all day long, and it's very effective at preventing infection.
Yeah, it's a myth, I understand, people who are concerned that wearing masks could somehow be harmful to kids, to their breathing. Is that correct?
Yeah, again, we've been married. I've been wearing a mask for a year and a half, and
My daughter too. Yeah, she's a healthcare worker.
No medical impact, and none has been documented anywhere.
Yeah, exactly. Some of the parents also seem to believe that children were unlikely to transmit COVID to other people who might be even more vulnerable than children. Could you please respond to that we were hearing from some of them today?
Yeah, I think that's sort of a residual from the early days of COVID when we thought children were much less likely to transmit. We've learned since then that they are part of the transmission cycle. They spread it to each other in places like school, and then they bring it home to the more vulnerable people who may be in their families. So to get over the pandemic, we're going to need to include children in the vaccination and mask wearing campaigns. But if we do that, I'm pretty optimistic that we can get past this once and for all.
Yeah, that was my next question. I do want to throw in here that, we lost a member of our own family that, just a minute, I'm going to turn the ringer off on this phone so it won't keep ringing. A member of our own family, a 50-year-old man with 5 children, who died because his coworker brought in unmasked, unvaccinated teenagers, and one of them gave him COVID, which he then brought home to his whole family. So definitely, you're right. Teens and children can spread it, even if they seem healthy or even if they're asymptomatic. It's possible.
You've reached the Hostilities County Magazine and Marion Factory. Please leave a message.
But I'm sorry, I can't get this into all.
I mean, that's what's been so tricky about SARS-CoV-2 as a virus. It's very good at infecting people and causing transmission before you're sick, or even without making you sick. So that's part of the reason we've had such a problem controlling it.
Yeah. Let me see what else. Do you see light at the end of the tunnel? I mean, we should note that, shout out to San Diego, in our region, 89% of those who are eligible for a vaccine, meaning those 12 and up right now, have had at least 1 dose, and over 80% are fully vaccinated, meaning 2 doses if you had Pfizer or Moderna. How high do we need to get, do you think, before we'll be out of the woods here and life can return to normal?
Well, I wish I knew the answer to that. It's sort of the $1 million question, but San Diego and California generally is doing much better than much of the rest of the country. Evidence for that is we've reopened schools without terrible disaster happening. Although we're seeing some transmission in schools, it's under control because kids are wearing masks and they're isolating as much as they can. And if we add vaccine to that, again, I think we're going to get over the hump and be able to put this back in place. And it may be with us for years to come, but it won't cause this much disruption.
Yeah. What else would you like our viewers and our listeners to know, Dr. Sawyer, about COVID that I may not already have asked you about?
Well, there's been a lot of focus on booster doses and immunizing kids, which are important, but by far the most important thing is to get the adults who have not been immunized. That's going to cut down on hospitalizations and deaths, which is still a problem in the United States and around the world. So we need people to get vaccinated.
Yeah, we just put a story up about first responders, the resistance among police unions, a lot of them who think they're, strong and healthy and don't need it. And actually, I was rather shocked to find out that COVID is the leading cause of death among police officers this year and last year, nationally and in California. In California, last year, it killed more police officers than every other cause of death combined. The odds nationally of a police officer being killed by COVID-19 were 5 times higher than being killed in a shootout, which I'm sure is what they're all concerned about.
Wow, I had not heard those numbers. Those
Yeah.
are pretty sobering. And if that doesn't convince people to get vaccinated, I don't know what will.
Yeah. Yeah. Well, I want to thank you so much for taking the time to join us today, Dr. Sawyer. And feel free to reach out to us anytime you have new information or breaking news on COVID-19 and the vaccines that you would like to share.
All right, thank you very much. You asked great questions.
Thank you very much.
Thank you, Mark.
Okay.
Thank you, Miriam.
Thank you, Carlos, for setting this up.